Hi, my name is Madison Merriman. Today I'm going to be demonstrating NG insertion and removal. So I would enter the patient's room, look at the medical records, I'd perform hand hygiene. I would check the patient's ID band and verify the name and the date of birth of the patient. I would explain the procedures to the patient and then move the bed to a comfortable working height. I'm going to place a chest pad on the patient. Now I'm taking out the tube. And I'm just going to measure from the nostril to the ear, and then from the ear to the tip of the xiphoid process. And I'm going to mark this with tape.
I would take the old ball out and then take each Q-tip.
Putting on some gloves now. And I'm going to use some lubricant and put it on the end of the NG tube. And I'm going to have the patient tilt their head back, and I'm just going to place the tube down the nose, following along the floor. And then once the patient starts like gagging and having some issues, I'm going to give them some water and just have them sip on the water, and then when they swallow, I'll progress with the tube. Then I'm just going to temporarily secure this in place while I wait for an x-ray to make sure that this is in the right spot. I would also check with a tongue depressor just to make sure that the tube wasn't coiled in the back of the mouth. Now that I know that this is in the correct place, I'm just going to remove the temporary tape. We're going to secure the tubing to the nose. And then I'm going to measure the amount of tubing that's outside of the body. So about 35 inches. The next thing I'm going to do is just check for gastric secretions. They're present. I'm going to dispose of that, and then I would flush with saline and apply this to the suction. And then to remove it, I'm just going to loosen the tape. And I'm going to provide the patient with an emesis basin. And then I'm going to kind of twist this around my hands and then just pull it out. Coiling it into the touch pad and removing it from the patient's bedside. I would then perform oral hygiene if it was necessary. And then I would put my patient back into a comfortable position.